Hi guys, my name is Zha-nee. I'm going to be trying something a little bit different from what I normally do when I record. Basically, I do make TikTok videos. I do make like little YouTube videos, but YouTube videos are more like vlog and my experiences, and my TikTok little videos are more so the TikTok videos are more educational, but it is 1 minute and I have to talk really fast, so that doesn't really help me with my client education, even though these are topics that I talk about often. So here is just a chance for me to talk about different topics. So we're going to be going over some current event stuff. We're going to be going over some like medicalized stuff without me giving medical opinions, just putting information out in the world. We're going to be talking about public figures inside the perinatal world and different things. So just flow with me as I go. I will be trying different things. So today my video is this way. I'm using natural light, but I'm just trying different things. So that brings me to what we're going to be discussing today. May 27th, it was an article that came out by JAMA International Medicine and Trends. And so it came out May 27th from JAMA Internal Medicine, and this is just discussing mental health. And it's declined since what they first started. And the article title is actually called Trends and Disparities in Maternal Self-Reported Mental and Physical Health. Disclaimer, I do understand everybody who is a mother is not identifies as a woman. I do also understand that everybody who nurses does not have breasts. They also have chests. I love and I will try to use gender neutral terms as much as possible. So if you hear me saying breast, chest, or parent, or mother, or whatever the case is, because I do want to be respectful for everybody. So in places where they do have articles like this and it says maternal, I'm just going to read it like that. But if I'm using more of my personal, like talking to you guys, I will say maternal, parent, birthing parent, all of the terms, so everybody feels included with my conversations. After this article came out, a lot of different news outlets reported the story. New York Times, Urban Health Today, and so a cool study was conducted from 2016 to 2023 from all types of demographics, and we'll get into that a little later. The people who are in a study are adoptive parents, biological parents, who do identify as female, biologically female, and self-reported. So basically that means that when they did some type of screening, these results came from that, versus if a doctor or somebody else seen it and medically declared something. The mental health screening assessment had different criteria, self-reporting criteria such as poor, fair, good, and very excellent as far as their state of mental health. Mothers/parents who reported excellent in 2016, that rate was 38.4%. So before we get into what that study actually said, I wanted to kind of go through that demographics. So if we look at our screen, you'll see some demographics on here. Have a range of ages, so infants to adolescents of 17 years old. We do have Hispanic people, non-Hispanic people, Black people who identify as Black, white, and multiracial. We do have different types of insurances, public and private, as well as the maternal mother parent age, so 18 to 24, 15 to 29, 30 to 34, 35 to 39, and then the last category is 40. Other demographics that was included in the study is their school education, high school diploma, some college bachelor's degree, if they were born in the United States or not, and their family structure. So is it two parents? Is the parents a male, female? Is it a single female a household or is it a same-sex female couple? It's all going into the demographics. They are self-reporting. The researchers do have the self-reported option that the parents can report for the screening, which is poor, fair, very good, and excellent. When the study was initially started, the people who reported excellent, that rate was 38.4%. However, when it concluded in 2023, that very good self-reported result dropped down to 25.8%. Mothers or parents who reported fair or poor in 2016 was 1 in 20 parents. And in 2023, when that report was concluded, it decreased to 1 in 12. Look down some more. The overall study of participants in this study was 193,417 parents total. So from 2016 to 2023, that's how many people were in the entire study. Of the current trends of people who did have that, some of the factors were similar. People who had lower education, those who had public insurance, as well as family structures who were in the single household, so just the mom or the parent present, had the lower decrease and lower mental health self-reported rate. At this time, I just wanted to actually define. So perinatal mood and anxiety disorder, also known as PMAD, is a perinatal mood umbrella term used to refer to mental health disorders that parents experience during pregnancy after having a new baby, adopting, or experiencing pregnancy and infant loss. Postpartum depression is often used as an umbrella term or an interchangeably with mental health diagnoses that may occur during pregnancy or during postpartum may include anxiety, bipolar disorder, psychosis, depression, obsessive compulsive disorder, and PTSD, post-traumatic stress disorder. Now that we have that general understanding on what mental health conditions or things that they can experience in pregnancy or after pregnancy, we have a little bit more understanding what these parents are reporting. The article also talk about mental health and support partners into parents and fathers. The researchers noticed that the mental health in fathers or support parents decline is also similar to the mothers, and that in 2016 the mental health was 29.9% in 2016, and it decreased to 26.4% in 2023. Rates are consistent. The decline in rates are very consistent with suicide, and depression comes basically with the drastic or the decline in mental health for the parent and for both of the parents, essentially, right? So outcomes that may affect the child or the newborn later on in life, which are two health contributors, social aspects in children, such as substance disorder, and they're more likely to be in an intimate partner violence situation, so basically a domestic abuse situation, as well as mood disorders currently in this pregnancy can lead to adverse birth outcomes such as low birth weight, which are babies that are born at term but are at or less than 5.5 pounds, as well as babies that are born before 37 weeks. Quick fact, mental health conditions are now currently the leading cause of death in pregnancy. That rate is about 22.7%, and that is the leading cause. So what are some potential risk factors that are leading to that decline in mental health? According to the article, It's access to mental health care. It's inflation that's been happening. It is racism, depending on the race of the parent, gun violence, climate change, rise in substance abuse, social isolation. We're now knowing that most of the time that people are no longer having a community, so it's usually that mom of that person giving birth and them by themselves, but I think this is more towards the single parent. So now I am going to call to action. What can we do watching this video? You can find the underlying causes of mental health disorders here in America. I think that this is not a conversation that's talked about a lot. It was actually up until recently that PMAD and postpartum mood disorders and all of that has been, recognized as a real medical condition. Another thing that we can do is develop programs that target and prevent diagnosis of this, and as well as treatments out there. The oldie but a goodie, continue to address structural factors contributing to health disparities. A race that is more susceptible to PMAD, and kind of go to that and help them out, give them the resources, and improve access to mental health. Another thing to consider, that parents who do have PMAD or perinatal mood disorders, it is likely that that mother-parent dyad relationship may be disrupted, and that there will potentially have an bonding may be disrupted. There is untreated perinatal mental health conditions. It can lead potentially to postpartum depression and other postpartum mental health disorders. Are some supports. So if we look at our screen, we see the samhsa.gov. They talk about different types of mental health disorders where you can get help, as well as mmhl.org. They have different fact sheets talking about paternal and spousal support, maternal hotlines, as well as a quick fact sheet of health disorders. What are some basic signs of perinatal mood disorders? Mood swings, tearfulness, irritability, fatigue, changes in appetite, easy agitation, sadness and fatigue, sleep disturbances, little interest of pleasure, detachment from the baby, and thoughts of harm of you and yourself. And there are different types of screenings that you can do. You have the Edinburgh depression screening, bipolar disorder screener, and these are all self-reported. So again, you can take it yourself, screen yourself, and see if you are feeling these things, or if somebody you know are feeling these things. And yeah.